Brilliant. As you can probably see, I've got paper, and maybe paper should be banned in this part of the talk, but we'll ignore that fact. Okay, and I'm also going to set myself a timer to make sure I don't overrun. Maybe it's chair's privilege. Okay. So I love the title I was given. I just put open brackets mental health, because that's my area of expertise. As mentioned, I'm a consultant psychiatrist, and my special area of interest is digital psychiatry and neurodiversity. So I'm going to talk a bit about, in my 10 minutes, about where we're at in regard to digital transformation, a couple of themed areas, which we call ICE, so improving clinician efficiency, enabling digital mental health, and a little bit about training the workforce for our digital NHS. So I think in the recent 5 years, we've had 2 eras of digital revolution. First is COVID, and I always joke that maybe the only silver lining is we went from only seeing people face-to-face or using a telephone, but actually realizing we can use a computer to see patients as well. And I remember being a CCIO in an NHS trust trying to talk to my colleagues about Skype, and they thought I looked like an alien. But we managed to do it with COVID. So there was a big push, and it happened. This is NHS benchmarking data, and it just shows the shift from face-to-face telephone contact to digital. And certain specialities within mental health did really well. So what you might expect, CYP, so children and young people, did pretty well, getting up to about 27%. But surprisingly, children's LD and LD services did much better, getting up to 29%. This is between 2020 and December 21. Unfortunately, it's not been sustained. And we've gone back to our previous behavior. So this is last year's data, and the top, I don't know if it's going to work, let's see. No, it's not going to work. So rather depressingly, in my speciality, general adult, we now text more patients than we have video consultations. So we've gone back to previous behaviors. So only 3% of appointments are digital. And even CYP, or gone a bit further forward, CYP, where you might expect it to be more commonly used, has gone to pre-pandemic levels of 10%. So any of those sort of digital transformations, at least in mental health services, have gone back to the kind of standard state of play. And why is that? I really like this slide. I stole this from one of the QI teams I worked with from the Dartmouth Institute. It's in essence, healthcare is all about people, and people is around relationships, and we go back to our old behaviors, yes? And if we're just introducing digital technology in the way that we've always done it, top down, not co-produced with our patients or our carers, not bottom up, the changes are not going to be sustainable. We're now in what I would call wave 2 of digital transformation, yes? We've got a big push from the centre. And again, everyone knows about this, which is the 10-year plan, but just to pull out a couple of bits for digital. Increasing use of NHS app, ambient voice technology, so AI, to reduce admin burden by 50%, and perhaps optimistically, over-optimistically, 2/3 of outpatient appointments to be replaced by digital support. It's potentially saving 1.4 billion if you believe the government's plan. I think that's highly ambitious, but maybe it's a stretch target. So let me give you some concrete examples. What is the thing, as clinicians, we interface the most technology-wise? It's our electronic patient records. In mental health, we've had the privilege of using this for 20 years. Acute sector, maybe not so much. And in essence, we've created this digital filing system, which in essence means you can't find anything. And why have we created this? We've had a non-user-centered design of other people telling us as clinicians how to develop systems that don't work for us. So what does that mean in a practical sense? In a practical sense, it means a CPN will spend 1 hour seeing a patient and 2 hours typing that up. It means in mental health, you can spend 30% of your time face-to-face with patients and 70% of that time away from patients, where the predominant is data entry. That is not an efficient NHS service. So problematic is it that 5 years ago, one of the first ever CCIOs in mental health, Professor Joe MacDonald, who created a great North Care record, called it Data Armageddon, because it's such a problem in mental health, and I'm sure you guys in acute are feeling this as well. And interestingly, even in 2021, the now defunct NHSX was talking about user experiencing, probably already knowing the fact that actually these systems are not built with clinicians in mind. Where's the future? So in the old days, you might have talked about voice recognition, front end, back end. We're not talking about that anymore. We're talking about AI. There's lots of AI tools out there. We've got people talking about AI shortly after me. This is an anthem. This was created by a child and adolescent psychiatrist in Berkshire, who's CCIO. And in essence, it's showing a 40% reduction in admin time. So let me just again give you a concrete example. In order to do an autism assessment, clinically that takes 2 to 3 hours. It then takes 4 to 6 hours to write up in a manual process. If you can cut that by 40%, you increase the efficiency and productivity. So what would we do with this extra time? Well, we've already got articles out there from the Health Foundation that some of us, including myself, contributed from the Royal College of Psychiatrists, talk about what will we do with this time. We could see more patients. We could maybe finish at 5 o'clock, that novelty thing. We can even maybe attend some courses. Yes? But obviously, from the centre, we're thinking about productivity. But it's got to be absolute nonsense that you spend 1/3 of your time clinically and 2/3 of your time doing something else. I've done that as a consultant psychiatrist. I spend 50% of my time seeing patients, 50% of the time feeding the beast. It's incredibly inefficient. What about other technology in healthcare? Apps. We're all obsessed with apps. We've all got apps. We're all on our iPhones today, yes? But can I, as a psychiatrist, recommend apps to my patients? Only very few. Yeah, so we're in a position where there are lots of apps out there that we can't really recommend to patients as a clinician. Obviously, there was the NHS app library that's closed, and now there's Orca. But I'm going to show you 3 apps. One's Brain in Hand, which designed by a university, and again, another one, My Mood Coach, and then the only one that is approved by NICE is Sleepio, computerized CBT. So apart from the NHS app, that's 4 apps I can confidently recommend as a psychiatrist. Now, there are loads more apps out there, and I recommend mindfulness, but it's not technically approved. So we're in a really difficult position where we can't do that on a routine basis. But there are other exciting techs out there. There's digital ECG, so this is the Aliva Core 6 lead. 1 lead back in the day. I did a Health Foundation project back in 2016, which showed if you use collaboration, and we work with community pharmacies, we kind of did that neighbourhood stuff that everyone was talking about in the morning, as well as using digital tech, you improve the physical healthcare of our patients. People with psychosis die 15 to 20 years earlier than a standard population, and that's predominantly due to the physical healthcare. So we're struggling to reach this group, and again, this is where digital can play. There's often the concern that you can't use digital with older adults. This is one of my friends and colleagues, Manny, who did this work with dementia population, collaboration with the Health Innovation Network, and showed you can use digital ECGs at home, nursing staff, doctors, it doesn't matter what the professional is, with patients in order to get their health checks. And it saves money. So as an organisation, they save £300,000 by using digital ECGs. Another really interesting area, at least in my specialty, is virtual reality. So can we use virtual reality on our wards? So one of the old trusts that used to work for were rolling out virtual reality in their CYP services in Kent and Medway. There's a big national trial looking at virtual reality in inpatient units. We know boredom drives violence and incidences. And when we're thinking about patient safety, virtual reality could be an option for that. So that is giving patients therapeutic intervention using digital technology when we are not awash with, unfortunately, psychologists, OTs on our wards. The question is, we are all innovators in the room. What about the rest of the workforce? Are we carrying them with them? Are we doing hero leadership that the King's Fund would talk about, that we're all marching ahead and leaving the mainstream workforce behind us? Are the rest of the workforce ready for digital? Maybe? I'm not convinced. So how do you help that? You have to train the workforce. So we were one of the first Royal Medical Colleges to have a data and digital literacy framework. I'm obviously talking about digital, but data is so important. Understanding your population mental health, moving away from the individual in the clinic to the wider population. And again, themes that you would have seen that I'm talking about, these are our main focuses. And the idea is that we train the workforce in order to be ready for the digital technology. Obviously, when you're designing a course, you think it's brilliant, but you hopefully want to hear the audience also feels this way. So this is one of the trusts we trained up in Nottingham. We've also trained trusts up in Kent, and we're doing a training session in Birmingham. And it's the idea is that you then foster and encourage that digital innovation within the organisation. Thank you very much. I also have, thank you. I don't know if I stuck to time, actually, but no matter. So I also have the pleasure to introduce our next sets of speakers. So we've got 2 talks on AI, so hopefully they complement each other really well. So first up, we've got AI that connects care, and its colleagues from Health Orbit AI, Prof. Anderson and Bala Sudhir. And Prof. Anderson is a GP and Director of Workforce, and it says on Bala's bio, he's an NHS specialist and export catalyst, but I'll hand over to Prof. Anderson first.